To best outline my research, I'd like to begin by offering a vignette derived from my dataset, and in doing so, I'd like to introduce you to a gentleman named Frank. Frank, who was around 70 years of age, lost his wife in 2019, and upon doing so, experienced a wave of intense emotion that he'd previously not felt before. Frank really wasn't sure what to do about this, but after a period of quiet introspection, Frank visited his GP. Frank was then referred on to a community link worker. Here he engaged in a conversation about what mattered most to him and what activities Frank found most meaningful. It was here where Frank was offered the opportunity to engage in a creative writing group. It didn't go so smoothly at first, but after about 6 weeks of attendance, Frank began to express his emotions outwardly, get his feelings down on paper, and his mental state began to improve. Beyond this, Frank engaged also in a BBC co-production of his poetic work, and has also been involved in theatre groups that have dramatised some of his poetic work as well. Frank, through this portrait, represents a success for the policy of social prescribing, and his journey surely is an indicator of what's best about policies like social prescribing, whose aim is to connect people to what matters most to them, finding meaning and purpose again that can sustain them in their everyday life and communities. Nevertheless, my work, through drawing on interdisciplinary and multidisciplinary theory and methods, looks to offer a more nuanced portrait of social prescribing. Beyond the success stories like Frank's story, there are also stories of men who struggle to engage with their emotions and have not had particularly good experiences of social prescribing. And my work is looking to see if, in balance, social prescribing does indeed add meaning to medicine and is a successful way of engaging communities with robust forms of assets and resources that we associate with the social determinants of health, or rather if social prescribing, in the title of one notable literature review, is more rhetoric than reality and indeed fails to offer a meaningful intervention. Thank you.